I'm going to go through about 60 years of research, okay? So some of you may have to go back, and some of you I know weren't even here 60 years ago, I know. But for those of you who were, you'll know what I'm talking about. So what I want to do, the message I would like to send, is that nursing has come from seeing our work as just a job to professional practice. Those words are very, have you ever heard a physician talk about his job? Have you ever? They always talk about their practice. Have you ever heard a nurse talk about practice? You will. Increasingly, they talk about their practice. Now, APNs do. Have you heard that? The heart of nursing. I mean, I know you guys think you're the heart, but the heart of nursing is the clinical nurse at the bedside. That's still where 80% of us are. 80%. And it's not going to go away. That's where we have to change things. Okay, so that's the whole theme I'm trying to get across, is we are coming from nursing as just a job. That's really pejorative, you know, when you stop to think of it. And staff nurse. I see I didn't make an impression on some people. We are not staff nurses. We are not the nursing staff. Now, I'm not deriding nurse aides and ward clerks and dietary workers, but all of them are included in nursing staff. Their work is different than our practice. And it is insulting nowadays to be called a staff nurse. We are clinical nurses at the bedside. In one hospital, I've been to 2/3 of the magnet hospitals. We have visited and interviewed nurses, physicians, experienced nurses, new graduates. And at one of the hospitals, when I interviewed the physician, he said, "Oh, I'm so glad to see nursing is doing something about that staff nurse." He said, "We hate that as much as we hate being called house doctors." And in that hospital, the nurses and the physicians got together and mounted a campaign with you-know-who, you top dogs, to get that out of the whole system. The idea of physicians being called house doctors and nurses being called just a staff nurse. And they did it. Francis Ryder, 1946, first wrote about nurses being clinical nurses, not staff nurses. 1946. It's taken us that long. UCH, University of Colorado Hospitals, Mary Krugman, and by the way, this is all published, so I'm not saying stuff that I shouldn't ought to be saying. You know what I mean? Okay. They're one of the first hospitals that changed it hospital-wide. And what I mean, changed all the papers and everything so that it went hospital-wide, that no longer staff nurses, but clinical nurses. And now Magnet has finally switched to clinical nurses. And now every one of you in this room is going to go back to your place and do something about it, aren't you? The response is yes, okay? All right. Hey, come on, you got to get going. You're not off your first slide yet. Okay, characteristics of nursing job. You can read that. I don't have to read it to you. The major change between, say, the 1950s and 60s, 70s, on up to the day, is that we have changed the whole system of work organization. When Marilyn was a new graduate, and many of the rest of you as well, nursing looked upon its work as a series of tasks. Catheterizations, taking temps. Gradually, we added some higher skills, if we will, like physical assessments, right? Starting IVs, but we were still very task-focused. Some of the tasks we parceled out to nurse aides, but when I had my very first job, 2 years out of school, I was one of 5 RNs staffing a 1,000-bed hospital in Cleveland, Ohio, Cleveland Metropolitan General. All units were staffed by LVNs and aides. And we ran not only this 1,000-bed hospital, but 3 other hospitals besides the polio center for the entire northeastern section of the United States. 2 years out of school. That was my job. Okay? It was very, very, very task-oriented. We have finally moved and understand now that to be a profession, you have to look at as a whole task, as doing the whole practice. Whether you do it or not, you are responsible. And one of the finest things, when I say you, I'm talking about chief nurse executives, okay? I'm just kind of piling you all together. I mean, I know that there's a mixture of you in here, but is that okay with everybody? You're the boss, right? In whatever area, okay. The part-task system operates on Newtonian principles, Newtonian science. Now, what is that? Because all of you know this, I know. Newton, Isaac Newton, an apple always falls down from a tree. So Newtonian science is based on mechanistic A plus B equals C, 1 plus 2 equals 3. It's science that all of us have been raised on. It's a science that men in particular are cotton to. It has been shown. Women slide a little from Newtonian every now and then. But it's also the science that research is based on. Independent plus the independent variable, its impact on the dependent variable, right? Now, we have loosened up a little bit with intervening variables, but by and large, research is a study of the impact of the independent on the dependent variable. It's not good enough anymore. Now, it's not that Newtonian science is wrong, but we need something more. In the complex world we live in, and particularly in healthcare practices like nursing, and we've known this for at least 10, 20 years, complex adaptive systems, systems theory, complexity theory, and science have entered in. And that's what I want to talk to you about today. All right, types of services. All right, now here's the deal. You have to understand that there's things that are simple and then there's things that are complex. Now, I'm sure that that's no surprise to you. But you can have simple and complex. Then you can have things that are sequential and simultaneous. Now, if I had time, I'd read you some scenarios. I have hundreds, thousands of these scenarios. When I go to interview nurses, physicians, chief nurse executives, experienced nurses, when I go to interview them, I always ask them to give me examples. And they come out, they flow through, and that's why I have hundreds and thousands of these scenarios. And they tell the story. One of the first, way back when I wrote the Reality Shock books, the first 3 pages of the Reality Shock, there was this new graduate. She and a nurse aide were responsible for a 20-bed post-cardiac care unit, and in this large hospital where I was working. She was working the evening shift, and part of the responsibility at that time was that the nurse on the unit served up the food into trays, and then the aide delivered it to the patients, right? That's part of nursing jobs, right? You're supposed to shake your head, yes, that was at that time. All right, she sent the aide off to get her dinner at about 4:30, so she'd get back in time for when the trays came. The nurse started to make rounds on patients. Came to one patient who was sobbing in bed. This lady had come in, she was going to have cardiac surgery the next day, and she was sobbing because she was afraid she was going to have post-surgical psychosis, which at that time was rather common, post-surgical psychosis. And when she did, the last time she had it after surgery, she really went berserk. Threw things, cussed the nurses, did all kinds of bad things. She was afraid this was going to happen to her tomorrow because, it happened once, it'll happen again. And she worked on this unit as a nurse aide, and she was afraid that if she blew her top after surgery, that they wouldn't let her come back and work on the unit anymore, that they would be mad at her and so on and so forth. And she was sobbing and crying. So you're sitting down, holding this lady's hand, talking to her, and the food cart, you hear it outside. Now, with this food cart, it was important that you dish up the food properly and that these post-cardiac patients get the right kind of diet, right? Furthermore, the supervisor wanted that food cart back in the kitchen because she needed it to serve food on other units. You get the picture? What are you going to do? You're the nurse, new graduate. What are you going to do? You're supposed to answer. All right. But you get the problem. This is a situation of multiple patients, and it's not particularly complex. Serving up the food, it's pretty Newtonian. You pick up the spoon and you put it, what are you going to do? Do you know what new graduates answered in the 1960s, early 70s? It's better to meet the needs of 19 patients than one. That's Newtonian. Do you understand that? If you stay and listen to the one patient, you're meeting the needs of one patient. Otherwise, you're meeting the needs of 19. 19 is more than one. I illustrate this to you, not to punch holes in ourselves, but to understand the difference in thinking. Simple thinking, if you will, versus complex thinking. All right? All right. Now I'm going to read you the thing that's causing reality shock now. That was the thing that caused reality shock back in the 60s and 70s, okay? I'm going to read you an illustration of the kind of problem that new graduates are faced with today that cause reality shock. All right. Joe is a 22-year-old hockey player, was one of my 5 patients. He was admitted with a swollen belly, unexplained recurring fever, weight loss, and itchy skin. A year ago, he was diagnosed with Hodgkin's and had had radiation treatment. When I admitted him, he told me with a bright, happy smile and tug on the blonde curls of his soon-to-be wife that he had been cured. He had been feeling great up until about a month ago when he was admitted for diagnostic tests. He'd had a slew of them: liver and kidney function, CT scans, bone marrow, and lymph node biopsies. Another of my patients was Mrs. Allstairs, in her 60s. She'd been in and out several times with pancreatic cancer, treated surgically and with chemo, but was wretched with pain. She's on IV morphine, and she can barely make it from the administration of one dose until she really needed it, the next one. When I did my initial assessment this morning, I sat with her a while, and we talked about distraction methods. I'd been working with her on that over a period of time. And what we'd work out was listening to the Even Rourke books on tape. I don't know if any of you know Even Rourke, but I don't know who the author is. Anyway, but it was a series of books that kind of took her mind off of the pain and into this detective and his wife, or the police officer and his wife doing stuff. Okay, it's a good book to listen to on tape that would help her handle the pain when it was getting near the time when she could have a dose, but, wasn't there yet. Okay, I read her summary. Okay, the morning's been going fine. It's about 10 to 9. As I'm on my way to draw up Mrs. Allstairs' IV morphine, which she can have at 9 o'clock, Dr. Mellon stops me, says good morning, and asks if I have Joe today. I figure I had enough time before. When I nod, he says he's on his way in to see him and asks me to come along. I figure, gee, that's great. I had enough time before 9 o'clock, so I go. After some preliminary, how's the belly today? Dr. Mellon says, Joe, I have the reports of your tests, and they're not good. Your Hodgkin's has come back strong. You are already in stage 4B. The outlook is worse when the cancer reoccurs and spreads in less than a year. As soon as Dr. Mellon began his report, I had put my forearm on Joe's shoulder and reached for his hand. Joe was absolutely shocked, as was I. His face paled, his eyes got big and bulgy. Dr. Mellon patted him briefly on the arms and said, "Beth is a good nurse and will take care of you." Told me to write down any questions Joe had, that he'd come back and see him tomorrow. And he left. Joe looked at me with a shocked look, eyes brimming with tears, and said, "He's leaving? Please don't leave me. What did he mean? Am I going to die? Like now? I'm so young. I have my whole life ahead of me. Marge and I are talking about getting married this summer." I was reviewing in my head what I knew about Hodgkin's. Cancer of the lymph nodes, seen in very young adults. Prognosis not as bad as it used to be, but very bad if it reoccurs within the first year. And I also have to admit that I thought about how I would feel if this were happening to me. I'm only 2 years older than Joe is. Joe is clutching me like it was a lifeline. I just held on to him and let him cry and said, "Don't worry, Joe. I'm not leaving you. Go ahead and cry. Share with me whatever you'd like. Let me know if you'd like me to phone Marge or your parents." In my head, I knew that Mrs. Holsters would be in severe pain. She needed her IV morphine. It's already past 9 o'clock. Now, can you see the parallel between that and the 1 in 19 of 30 years prior? Do you see what I'm getting at? It's multiple patients, and they have different needs, and it's simultaneous. Nursing is the only profession, the only healthcare profession in which clinical nurses are expected to care for multiple patients simultaneously. We are legally, morally, ethically responsible for the care of, well, right now it's usually around 5 or 6. Isn't that about right on days in most hospitals? All right, thereabouts. And it's usually 2 in the ICU now, okay? I mean, that's what I have found in my travels, okay? We are the only profession. Do you know this is a shock to physicians? Physicians all care for patients sequentially. They go to one, then they bounce to the other. But when they bounce, even in the ER, when they go from one to the other, they expect that the RN is going to cover the patient that he left, and you damn well better. We are the only profession that is expected to cover patients simultaneously. Now, it might only be surveillance. It might only be thinking ahead about what you need to do. I'm not saying you have to be physically present, because we can't. But we are morally, ethically, and legally responsible. If something happens and they can prove that you should have caught it the last time you were in there, you're guilty. So it's not just illegal, but it's moral and ethically. And this is something that faculty do a hell of a job teaching to students. I mean, this is the thing that breaks them into tears. This is the thing that causes them to leave nursing. I've gotten that as the reason for why I'm leaving nursing more often. I can't do it. No other profession expects this of their practitioners.